Hello, I'm Doug Thompson, and I want to talk to you today about integrating periodontal medicine to minimize systemic health risks, a concept of using dentistry to provide total body wellness. We have a great opportunity because back in 2004, the whole world started to learn about how inflammation is a secret killer. And more recently, there's been more effective works on the idea about how inflammation is rapidly changing how we look at our patients, and that medicine is redefining heart disease as an inflammatory disease of the blood vessels. And what's good for us in dentistry is that it involves the bugs that live around the teeth and biofilm-mediated diseases. And as a hygienist or a periodontal therapist or a dentist or even an assistant, you're significant in helping patients discover and understand that. In fact, when I started to look at how patients were coming to me and they wanted fine aesthetics and they wanted me to work on conditions in their mouth, what I found is when I started to talk to them about health, they wanted really good health balance. And they really wanted more from me than just me to repair their teeth. And it was impossible for me to separate the teeth or the mouth from the rest of the body as I discussed health issues and health balance issues. And so we really became more of a reparative practice and moved into a wellness concept practice. And everybody on our team is significant in helping to make that come a reality. So we know we have to look at certain dental elements that we look at every time we evaluate patients, but what else could we help the patient with? What else, if we had a little bit of awareness of other diseases, could we see that the patient might need or we could help them with? And about these statistics here are either stats by the American Heart Association or CDC that talks about how there's a large percentage of undiagnosed disease sitting right out there in our practices. And if we just had a little bit of knowledge of what to say or what to do, we could help our patients significantly. So we're really entering a neat era. It's the era of preventative periodontal medicine. And it's interesting because periodontal disease is now cross-referenced with about 57 other related diseases. And you've heard of many of these, but now what do you do? How do you implement this? And how do you start to talk about it in practice? That's really what we want to talk about. We also have new tools. We have new tools and new concepts that allow us to personalize patients' infections, which I'm going to talk about in a minute, how that changes their attitude, and how we can be more precision with our diagnostic tools, and how we can be very preventative. That's really what we want to do in practice and help our patients. In this inside dentistry piece, talked about periodontal disease and systemic health, how we have these innovations that are shaping how we prevent the disease, how we diagnose and treat the disease. And just a couple of interesting comments about prevalence data, and that we know there's about 50% of our population that has some need. So this is a great opportunity for us, because even as your next practice day, 50% of those people would benefit from things you might tell them about other areas of their health. And we have statements like this that mention it's becoming clearer and clearer that a healthy mouth and that mouth health is the key to total body health and a healthy body. And it's nice because what is it? It's inflammation is the pathway to these other chronic diseases. And we know that inflammation allows organisms to migrate to other parts of the body and cause these other problems. So we have a great opportunity to educate patients and engage them in health discussions that really will turn into opportunities for us in practice. And we also have a good opportunity with these precision diagnostic methodologies that we'll talk about when we get into periodontal disease diagnosis. One quick comment about personalizing the infection and personalizing patients' health advice. Very important whether you put their name on it, show them a graphic, test something in their mouth, show them their bleeding, show them their periodontal chart, put their name on a report. It's very important because they take you much more seriously. So we found out, this was a study that shows that when you do that, they take the disease more seriously. We also like that for patients to understand that these are diseases of susceptibility. Periodontal disease is not a disease of neglect. In other words, they didn't get the disease because they didn't brush their teeth. They're susceptible to the disease. And in the disease module, we'll talk about the model of disease progression and how it happens. We also know when we personalize this data that they feel better about your treatment advice. They feel better that your treatment will be effective, and they feel positive about the overall experience. And that's a great thing for us in practice, because I never used to have patients feel so positive about periodontal disease management. Now I do. and it's really a nice opportunity. So the bottom line is to get a team of professionals, periodontal therapists, assistants, care coordinators, doctors, associate doctors, and even our admin team, to get behind a policy of how we handle periodontal disease in practice and how we talk about it, how we create awareness in our patient base. Because what will happen? It will add great value. It'll add great value to our services. And I can tell you that periodontal disease diagnosis and periodontal disease, it's the best springboard disease to start to talk about these discussions and dribble this into practice. So that's what I want to share with you through these small video series. A couple of things about disease detection and treatment of disease. It's hard to detect disease early. You might have to have a little more education, be a little more sophisticated, but treating it's easy. Detecting disease late is easy. You can tell when somebody has mobile teeth, large amounts of clinical attachment loss, but treating it at that time is very hard. So what do we want to do? We want to detect disease earlier so that we can treat it more easily and more succinctly. That's the idea. And what happens to us typically in our lives is we spend way too much money keeping the dying patient alive and not enough keeping the living patient really well. So that's exactly what we want to do. We want to keep our patients in a much healthier state of mind and state of health, that's for sure. So what do we hope to do? And our objectives through this opportunity is provide a structured methodology to evaluate, assess, and communicate findings as they relate to dental diseases, the ones that you work on already. But then also how to translate that same kind of information and talk about early diagnosis of heart disease, early diagnosis of metabolic diseases like diabetes, insulin resistance, metabolic syndrome, and then other diseases like hypertension and on and on. And then how to introduce healthy lifestyle concepts in sleep hygiene, exercise, nutrition, and stress management and other areas as well. And how we can introduce and talk to patients about gut health and probiotics and how exposure to pollutants could be causing problems for them and how the right supplements and the wrong supplements could be either hurtful or helpful. These are things that we want to learn how to talk about. We're going to do it in very bite-sized pieces. That's going to be key to implementation success because we're going to talk about implementation strategies. What do I say? How do I do it? What if I don't feel comfortable? We want to talk about those things and help you with that. And then we want to talk about the benefits of being a member of the Wellness Dentistry Network or considering it or retaining your membership in the network. How not just a library of materials or just having health knowledge is enough, but how networking with collaboratively with physicians and with other healthcare professionals really launches your practice to a different place. So it's the networking and the relationships that really make this come alive in practice. We want to help you with that. Obviously, we want to help you with that. And we want to provide for your patients what a lot of us want for ourselves. How many people, when you say, if you could change just one thing about your health, what would it be? Maybe I want to lose some weight. Maybe I want to feel better. Maybe I want to get better sleep. Maybe I want to get better control of my blood pressure. I want to control my migraines. I want to minimize my disease risk. I just want to be healthier. These are all things that many of us want. I can tell you your patients want them too. And you might not be aware of it, but you can help them more than you think. So I hope you continue to enjoy this series and come back and look at these little pieces. And I hope to join you again as we talk about our vision for our periodontal disease policy. Thank you very much.